This year, the Ebola virus has killed an astounding 961 people. While most of that is contained to Africa, there's growing concern now that 2 Ebola patients are here in the United States, actually just next door in Georgia. And it has us wondering what precautions are in place at our local hospitals. News 5's Alan Carter went to find out.
As the death toll nears quadruple digits, a new warning coming from the World Health Organization.
I am declaring the current outbreak of Ebola virus disease a public health emergency of international concern.
While most all Ebola cases are on the other side of the Atlantic,
the disease is uncontained and it is out of control in West Africa.
2 patients have come to the United States, currently being treated at Emory Hospital in Atlanta.
So the door would be closed.
Dr. William Green specializes in infectious diseases at Infirmary Health in Mobile. Fortunately, they've never had to deal with any case of Ebola, but he says they'd be ready.
Any room can be converted into an isolation room. We would convert it to at least a partial negative pressure room with an external device.
Ebola is transmitted through human contact.
So we would have gowns, gloves, and a regular surgical mask.
So a lot of their precautions deal with the way they come in contact with their patients.
The biggest concern is 2. One, for healthcare workers acquiring the illness and for transmitting that illness to other patients. The patient who might have Ebola, we would limit the number of personnel and the number of procedures that would be done just to limit the possibility of exposure to blood and body fluids.
Infirmary uses isolation practices quite often anytime someone has TB or measles or other airborne diseases. And most all hospitals have some sort of isolation plan in place. Ebola, though, has no proven cure and has no vaccine to prevent infection. However, experimental treatments have reportedly produced improvements in the 2 U.S. patients. Reporting live tonight in the newsroom, Alan Carter, News 5.